Aloha, everyone. Welcome to Coconut Wireless Episode 3. I have Dr. O'Carroll here with us.
Hi,
feel free to introduce
nice to meet you guys. I'm Dr. O'Carroll. I'm an emergency physician here in Honolulu, Hawaii, and also both of us are board members of Every1ne Hawaii.
Great. While we're getting people to kind of join the live stream, we invite everyone to kind of share quickly in the chat your name and where you're tuning in from, if you're comfortable. In the meantime, we will welcome you, and we'll also kind of give you a quick background of Every1ne Hawaii and what we're doing here. A quick overview, Every1ne Hawaii is a 501c3 nonprofit. We came together rallying around the mission of voter participation, but with the onset of this global epidemic that we find ourselves in, COVID-19, we pivoted and we did mass drive, and this is something that's really important to our community, and we hope that we can make a lasting impact by partnering with each other and with the greater community here in Hawaii to really make a difference. We're really lucky here today to have with us Dr. Darragh OʻCarroll, who is a member of Every1ne Hawaii, but really our in-house physician and medical expert who is really qualified to speak to the COVID-19 epidemic. So we're excited to have him with us.
All right, thanks, Keoni. Hi, Hannah. Nice to have you here. Anybody else needs to say hello, go for it, or not, but good to have everyone here. So yeah, where we are, and everybody's aware of the global pandemic that's occurring, and we'll get through some numbers here and some slides and talk about where Hawaii stands and maybe some projections for the future and what we all can do as young persons or just anybody in general to combat the spread of COVID-19.
Right. You know, COVID-19, especially here in Hawaii, has been hitting the headlines. And I know a lot of you viewing right now have been flipping through Facebook news feeds and the news and watching things online, and you may just be very concerned about what is the current status of COVID-19 here. It's quite alarming, but fortunately, I think Dr. Darragh can give us the COVID 101, kind of a quick overview of what it is and how we can have this fundamental understanding of it before we dive in deeper into the current status of COVID-19 in Hawaii, the current situation.
Sure. Yeah. So COVID-19 is an upper respiratory illness, and we'll get through some of the symptoms and causes shortly. But you know, it's one of the most contagious viruses since the 1918 Spanish influenza. You know, there are some more contagious viruses like measles and other respiratory viruses, but this is possibly the biggest threat to humanity that we've seen since the Spanish influenza, where it combines both infectiousness and also a pretty high mortality rate. So we'll get through different numbers shortly. I don't know if we want to skip to the slides because that's going to give us a good representation of where we are in the world.
All right, let's zoom out. Let's go over the statistics. Where do we stand in the world and the nation?
So, you know, there's nearly, this is kind of mind-boggling, but 20 million cases globally with, you know, 740,000 deaths. And just in the globe here, just in our country, you know, we're about 4% of the world's population, but we've got 5.2 million cases and roughly about 165,000 deaths, which is, you know, a testament to, you know, this is really ripping through our country. And now we're starting to see the effects here in Hawaii.
Mm-hmm. And I know, Darragh, you've also been on CNN and different news stations to talk with people at the global level about this issue. What are some of the observations that they've been sharing with you as you talk with them live stream there?
Sure. You know, I think the common theme is in any pandemic, the worst thing that you can do is think that it's not going to happen to you. Because as soon as you let your guard down, as soon as you stop doing the things that can combat spread, like masks, not gathering in large groups, you're going to see blossomings of the virus. Like they're seeing new blossomings in Italy and Spain and even in France. And, you know, you could argue now here in Hawaii, we had it really under control. And because really there's no one to blame but ourselves, we started doing careless things and thinking that it's not real, or either it's a hoax, or, you know, starting to congregate in too big of gatherings. And so that's why we're seeing increased cases here. So we've got, unfortunately, no one to blame but ourselves.
What makes coronavirus or COVID-19 so different from like SARS or MERS that we've been able to handle in the past, apparently? Is there anything that makes it distinct as a coronavirus?
Yeah, absolutely. So this is not the first coronavirus. it's actually the 7th human coronavirus. There's 4 benign ones, we would call them, that cause the common cold, which rip through, a lot of our young kids and a lot of adults as well. They're responsible for about a third of the common colds that happen in cold and flu season. But we had SARS, I like to call it SARS OG or SARS-1 in 2003 that infected about 8,000 people. There was some big outbreaks in Canada, didn't go globally. But what makes this coronavirus so special is that there's 2 different periods that I'd like people to be familiar with, and I'm not trying to lose anybody, but there's the incubation period, which is the time that you contract the virus to the time that you have symptoms. And then there's a latent period, which is that starts at the same time, the time when you contract the virus to the time that you actually become infectious. And on average, this number fluctuates slightly. We're seeing that the difference between when you start having symptoms and when you're infectious is about 2.4 days. So almost 2.5 days you are infectious, but you don't know it. And that's only if you go on to develop symptoms. There's been a good contact tracing study in Italy that showed nearly 74% of people under the age of 60 didn't go on to have symptoms. And we know that asymptomatic people are still shedding virus, still infecting other people. So in compared to SARS and also MERS, who is still bubbling out of the Middle East, those 2 viruses didn't have this feature, didn't have this asymptomatic spread, but also pre-symptomatic spread. So that's why it spread across the globe before we knew it. And so that's why it's gone so globally, and why we all need to act like you have it before it's too late.
So it's unique in the sense that it has an asymptomatic nature, and this latency period kind of makes it distinct. But is there anything unique about it in the way that it's transmitted to other people?
Yeah, absolutely. So we're still in the learning phases of this virus, but the more and more that we see, the more that we're realizing that there is a highest proportion of probably droplet spread. So what droplets are is when you cough, when you sneeze, you eject these kind of droplets of saliva and mucus that hang out in the air around you. And that's why Keoni and I are wearing masks. Even when you're speaking, you can expel some of these droplets. You all know that if you're at a party and somebody's had a couple too many drinks, like you get that spit in your face, right? I've never done that, but we know that's out there, right? So those are droplets, and so the predominant way that this is spread is droplets. We are starting to see now, and there was a great study that just came out this morning, that there's some really we really need to consider that there's a high proportion. And we don't know the percentages yet of actually aerosol spread. So that's even finer particles than these droplets, and they can travel farther and they can hang out in the air longer. And is why, again, we're wearing masks and why masks have been proven to work. There is a smaller proportion of probably contact spread where those droplets will settle down onto this desk, the chair you're sitting on, or this couch. They love smoother surfaces or hard surfaces like polyurethane or plastic. And then you could touch that surface and then touch your eye, touch your mouth, your nose, and transfer it from there. There's probably the smallest amount of proportion from that, the biggest proportion from droplet spread, and then some percentage of aerosol spread. So that's what's coming to light recently.
So although it is important to wear your mask, we still should be wiping down surfaces because that still does pose a risk, is what you're
Absolutely.
implying.
Absolutely. Okay.
Yep. And there are different ways of transmission, as you've described. Something that I can't quite wrap my hand around is the rate of transmission. I guess there's one is a certain rate that's safe, or could you kind of explain how that all works and the science behind it?
Yeah, absolutely. That's a very, really good question. There's something called R0, which is basically how transmissible this virus is. And there's a lot of different variables that go through, and you guys can go to rt.live, that website there. You can see how this virus is transmitting or how transmissible it is, and this number throughout the states. And basically, it's the number, say, Keoni, you were to get infected with coronavirus, the R0 is the average amount of people you would transmit this to. And so if the R0 is 2, then you're going to give it to 2 other people. And then those 2 other people are going to get it to their 2 respective people. So it's going to double. And so the most infectious viruses that we know of are something like measles. The R0 of measles is like 13. So that's one of the most transmissible viruses. But we're thinking the R naught is somewhere going to lie for this virus, coronavirus, is going to be somewhere around 2.4 to 2.5, somewhere around there. So that's really, really high. When you put it in context of the seasonal flu, and we've all get seasonal flu. I get flu almost every year because I'm around it so much. But seasonal flu rips around the globe every year, and that only has an R naught of 1.3. So that's just kind of displaying that this is twice as infectious as seasonal flu. So infectious that when I'm working around it, I need to be in almost a spacesuit and I need to be in goggles. I've never been around a virus where I have to wear goggles to keep me from getting infected from it. And if we bring up the actual settings here, where Hawaii is, so you've got everybody who's below one meaning if Keoni was to transfer it to less than one person per infection, that means that over the lifespan of a pandemic, it would actually peter out, which is you're gradually having or proportionally decreasing the amount of infection in the community. But if you look all the way over on the right here, Hawaii is first, which is not where you want to be. We have the highest infectious rate in the States right now. And that's really because people became too complacent and this virus kind of took a hold. And because it's so asymptomatic and has such that pre-symptomatic spread, we now have this big surge. And so Hawaii, it has the highest infectious rate in the country right now. And it's not a thing we should be proud of.
And is this something that happened just recently, or have we been at that rate for some time?
Absolutely. This happened in the last two weeks, probably. We were all the way down in the middle of the pack. And also when we had, the month of June where we had 0 cases many days, we were all the way towards the left. And so this is what's happening, as we said earlier, throughout on the global scale, is that if you take your eye off the prize, you're going to get bitten. And that's what's happening here in Hawaii, that we need to refocus and really realize that this is something to take seriously.
I have a quick question from a viewer. Christina asked, when should we wear goggles?
Very good question, Christina. I wouldn't recommend, if you want to be ultra safe, you could wear goggles anytime you're out in public. The times that I wear goggles at work are when I'm in a confined room with an obvious positive patient, and that's when I wear goggles. I actually wear goggles all the time, but I'll do kind of double up with a face shield plus my goggles. So it's an option. I wouldn't say it's mandatory, but if you want to be completely safe, I wouldn't think that wearing goggles is something you should avoid. It's really up to you.
Thanks. And thanks also to the other questions that are coming in. Leah, yes, this is being recorded and will be available on demand at a later time. Feel free to check back to our website or our different social media platforms. I realized that you just mentioned it's asymptomatic in some cases. So there will be circumstances where people show no symptoms but still carry it. In the case where it is symptomatic and there are things to look for, I mean, sometimes I'm just in an area and someone sneezes. Is that something that I should be watching out for, or what are some symptoms that we can be looking at?
Sure. Yeah, the symptoms, can be very varied. If you think of flu, that's probably the best way to describe the symptoms of coronavirus. Mm-hmm. You're going to have cough, fever, malaise, runny nose, some nausea, some vomiting, possibly a little bit of diarrhea. But it's very variable. One study from the CDC showed, and these are hospitalized patients, so generally the older patients and a little bit sicker, that only 44% had fever at the time of hospitalization. Mm-hmm. 90% of them almost went on to develop fever. So it's very varied, but if you think of flu, anything that's like cold or flu, sneezing, runny nose, sore throat, predominantly in the younger age group, you're going to have kind of more of a headache and malaise type of picture. So, just that really, I've got no energy and I feel like I got hit by a bus kind of thing. Those are the symptoms that you may see sooner in the younger population, but you can't just rely on fever. You're like, hey, look, a fever screening is going to catch some of the coronavirus, but it's not going to catch all. And it may catch a very low proportion in the lower age groups. So really think of flu, and if anything's similar to flu, you should be thinking of coronavirus.
Mm-hmm. And I know that when we first had the onset, perhaps back in March, I was aware of friends and colleagues that were unable to get tested because they haven't traveled out of state at the time. Mm-hmm. Have those criteria changed over time? Like, if perhaps can we be more sensitive to our symptoms, and when we kind of try to get a test done?
Sure, absolutely, yes. If you're having symptoms of coronavirus, as I just mentioned, please call your physician. Please call either Queen's COVID hotline. Hawaii Pacific Health has one as well. There's a lot of different resources on the Department of Health website, which we'll link to after this, where you can call and get tested. So yes, those have absolutely changed, those criteria. So good question, and it's something that everybody should be aware of.
Oh, thanks for that.
Yeah.
Also, a deep dive into, those are the kind of general symptoms for coronavirus, but what does it do
Yeah.
inside of your body is what I'm really curious about.
Sure, yeah, really, really good question. In that, so how this usually affects the person, and you get the sickest, is it usually infects in the lungs and replicates in the lungs. It binds to a receptor called the ACE2 receptor. And here is a picture of an X-ray, and very similar to many X-rays I saw even this weekend working in the emergency department. And I'll kind of orient you guys that that big kind of opaque or white thing in the middle is actually the heart, and the two big things on the side with the ribs that look kind of curly are the lungs. This person was sick enough, unfortunately, to be intubated. Again, this is just when I pulled off the internet, not a patient I saw, but I saw very similar X-rays to this over the weekend. And the lungs are mostly air. They're big, kind of big grapes that are full of air, and they're expanding and contracting, but they shouldn't have this sort of white appearance in it. And this is what we call is diffuse ground glass opacities. So what this is just lungs filled with inflammation and fluid because the virus and our immune system is going haywire. And so these people will walk in, and there's some things that are just really, really scary about it, in that their oxygen level, where an oxygen level in a healthy person, all of us sitting in this room, should be above 96%. Their oxygen levels are I saw somebody who was in the 24%, and anything below 80 to 70 is petrifying to me as a physician. I've never seen that before in my life. I've never seen anybody who's actually living or about to actually perish with anything below 70% oxygen level. So this is what an X-ray is doing. Looks like in people with COVID that are having chest pain or shortness of breath. And those are two symptoms that you should go and get emergency care if you're ever having those sort of symptoms. So that's what really it does. And then it also infects, because this virus is a little bit different than all the other coronaviruses, it can also replicate in the kidneys. It can cause kidney failure. It can cause liver failure. It replicates in the intestines. That's why you're having a little bit of nausea and vomiting and diarrhea. So this virus can do a whole host of symptoms and also cause a big inflammatory cascade that can predispose to clotting. And so there's young patients coming in their 30s, 40s with big strokes, with heart attacks. And it can even replicate in the heart and cause something called myocarditis. And so just because you are not so severe that you need to either be in the hospital or you don't perish from this disease, you can have long-term repercussions. You can be on oxygen for the rest of your life. You could be on dialysis. So just looking at the case fatality rate is really doing yourself and your family a disservice, because there's a huge amount who have been hospitalized and have long-term effects from this virus. Perhaps months, perhaps the rest of their life. So that's something to take into account. It's not just the case fatality rate.
Yeah. Well, thanks for going deep on this one case with the X-ray. I'm curious, as of today, how well does the medical community fully understand all of the ramifications of COVID-19?
Not nearly enough. In the first couple of months, we do have a better handle on it, but we don't have adequate treatments. We have things that can possibly stem the virus, but we don't have adequate treatments. The best things that we have are masks, which were brought up just earlier. Is that the reason why we have these masks is that to prevent the droplet spread. The best way to combat this disease isn't treatments. We have some things that'll stave it off, but it's to prevent the spread. And so, do masks help? Absolutely, yes. There was a study that in 1 month in New York City, when they had that big outbreak, once they instituted masks, as they modeled it, they showed that it saved 66,000 infections. And so if you think that this is around a 10% hospitalization rate, that's nearly 6,000 people that were spared, from being hospitalized. So masks are definitely helpful for spreading this disease. And then also there's been some really good studies about masks are actually protective for the wearer. You know, so if you're like, I don't really care about anybody else. If you care about yourself, you're going to wear a mask, because as this virus is circulating, either droplets or aerosol, the mask will prevent you from inhaling more of the virus. So there was a great study that came out in a factory, I believe it was in Spain, where everybody was wearing masks and infections did creep into it and into the factory. And 95% of the people had asymptomatic infections, which is way higher than, as I mentioned before, about 40% of the total population of people will be asymptomatic. So what that means is that when you inhale less virus, your body is more readily able to combat it and to fight it off. So masks are not only protective for the population from spreading it, but also for yourself. So the two, if the first reason wasn't convincing enough, hopefully the second reason is as well.
Right. I know the initial messaging was my mask protects you and your mask protects me. But what you're sharing now is that, I mean, more information has been coming out that your mask actually can help protect you as well.
Absolutely, absolutely. And it's not that hard. You know, it's just a mask. It does get a little bit hot, but you know, when you think of all your potentially at risk ill family members, if you think about our economy is now reversing the direction here in Hawaii, that we should, instead of reopening, if just simply wearing a mask is going to help, like come on, be akamai. Let's think about each other. Let's do it. It's the right thing to do.
No, that's great. And I do think we have a mask animation that we can share. No mask animation.
Yeah, look forward to that. Hopefully in the next week to 2 weeks, we're going to be dropping some culturally relevant mask animation shortly.
No worries. On that topic, you mentioned that masks are very key for reducing risk and reducing the spread. What are other preventative measures that can be coupled with mask wearing that we need to be aware of?
Sure, absolutely. Is not gathering in large groups. Anything larger than 10 is probably really high risk, especially if you're gathering in groups that are bringing different bubbles or different families together, where basically you're sharing each other's exposure, and now you're now exposing everybody. And so try and keep to if you are socially active, keep to the same 10 people that you normally hang out with, and try to keep those 10 people segregated and into different bubbles. Another thing you can do is also make sure you have hand sanitizer, wash your hands frequently, try not to touch your face or readjust as much as possible. So those sort of things, masks, physically distance when you're unable to, when you're out in public, definitely wear a mask when you're in public, and wash your hands. So those sort of things are probably the most combative for this.
I'm curious because I've been, my friends and I, and even colleagues have been put in situations where there will be a very important milestone in someone's life that needs to be commemorated. And kind of the only way that we know how to do it the normal way is by having a gathering.
Sure.
And in those situations, if beverage or food is present, I mean, you can't eat that with your mask off, so the masks come off.
Sure.
Is the fact that we're just meeting in a group of 10, does that reduce the risk, or are there still risks present, or does taking our masks off make it more risky? I'm just curious, because I think that's a situation that a lot of us are struggling with right now.
Absolutely, and taking the mask off does make it more risky. If you could have your gathering outdoors, if you must have a gathering and there's no ifs, ands, or buts about it, outdoors with proper ventilation is going to really, really help. And if you can, I suggest doing something like BYOB or BYOE, bring your own everything, bring your own drinks, bring your own food. You'll be together, but you're not sharing, handing each other different drinks, and make sure that gathering you are physically distancing. And again, outdoors with good ventilation would be the best thing to do it.
So I'm going to note that for myself. Outdoors, good ventilation, and BYOE.
Yeah.
And to the extent that, keeping the mask on when we're out eating or drinking is important too.
Absolutely, because we all don't want to see our islands, suffer a huge outbreak, which we are now. We want to stem this. We want to flatten our curve. And it's really, I know it's humbug, and, my birthday was earlier in March, and I did a Zoom by myself with some friends. And so you'll have another birthday next year. It's okay. But I understand those once in a lifetime gatherings are special, but you can do those sort of things that we just mentioned to mitigate possible propagation of this virus.
And as young adults, I think we perceive ourselves as more resilient than kind of more risky populations, elderly and very young. Should we find comfort in that and knowing that kind of we're going to be okay?
Yeah, and I think it's a false sense of security in that just because you may not be as affected as everybody else, if you're a young, healthy person, what's tragically showing is that our age group, the 20 to 40-year-olds, are driving the spread of this virus. Like, we're responsible for the largest percentage of a virus here in Hawaii. And up to, I'm not sure the exact percentage, but we'll bring up the graph here shortly where it shows what percentage of 20 to 40-year-olds actually have this virus. But it's that age group that are being careless, that are saying, hey, look, this isn't affecting me. I'm not a really low rate of mortality. I'm young and healthy. And I'm not going to take the proper precautions. But look here on this graph from 20 to 39, that's the largest. This was from August 10th, so it's not updated till today. But it's the largest percentage of people that have contracted this virus. This means our age group is the largest percentage of people that are contracting and spreading it. And so I plead with anybody who's 20 to 40 years old here is that you can't continue to do the things you're doing because you are, in effect, making it out of everybody here. Everybody has a responsibility, but our age group is making it predominantly worse here in Hawaii.
I had no idea that 20 through 39 age groups, specifically in Hawaii, had 1,408.
Yeah,
that is a really important statistic that for me personally is eye-opening.
Yeah, and so what you're doing is you're propagating this virus, putting our kupuna at risk, putting all our at-risk people with diabetes, high blood pressure, immunity problems. You're putting everybody here in Hawaii at risk by being careless. And so I think I would love to see this number, all these numbers drop, but I would love to see this number drop predominantly in our age group. Let's do what we can for our state, for our islands, for our communities, and do what's right.
So that's a great insight into kind of the age demographics of where it is. Where in the state is it spreading?
Where particularly is mostly Oahu. A lot of our Pacific Islander community is also, that's the other age group that's being affected, is our Pacific Islander group. They represent 4% of the population here in our state, but yet 30% almost of our infections. So that's another place that we need to be mindful of. Just because it's not affecting me, I'm not high at risk, doesn't mean you need to not be have the same precautions and thoughtfulness. Here in Hawaii, we pride ourselves for thinking about community, ohana, and aloha. Show your aloha for the state and do what you can. So those are core values that we know, that we grew up with, that we were taught, and we need to harness those.
This is all really important information, and you provided me with the new insight through the bar graph. If people our age or anyone watching wants to get this information, where can they access it? Sure. If they don't have a Dr. Darragh on hand, where can they go?
Absolutely, yeah. So there's the Department of Health dashboard that's gonna, they usually update it every couple days. It's probably coming up either today or tomorrow that they'll update it. We'll put the links into our comments here, and we'll get redirected at the end to the Department of Health dashboard, so you can follow the curves and also follow this live, and do what you can as well to keep everybody, including yourself and family, safe.
Okay. So I'm curious, and thank you for that. I'm definitely going to check that out after. What are some of the activities that put us at risk? I mean, we've heard on the news that funerals definitely are something that we need to be very cautious about. But I mean, do you kind of have recommendations for the activities that kind of have low risk or high risk, and what we should be mindful of?
Absolutely, yeah. So the activities that put you at highest risk are the risk activities that where you're going to be in the presence of more people, and also indoors with poor ventilation. So going to pub crawl at at some bars is probably the highest risk thing you could ever do, and you're being careless and spreading it to other people. Even just going to one bar is going to be high risk. Going to have drink out at an indoor restaurant is going to be high risk as well. Anything, if you could just move it outdoors, it's always going to be better. The funerals as well. Unfortunately, there are people who life doesn't stop. I understand that, but if you are at a funeral, it's such human nature for us in tragic times to be comforting both emotionally, but physically, and I would try to refrain if you can, if you are going to a funeral, limit the size of the gathering, but also avoid hugging, avoid kissing, because again, you could have this virus and not know it and transfer it to all of the family members that are there. Mm-hmm. So those are probably the higher risk activities. Just think more people in the indoors in a closer space where you're involving more kissing or touching is going to be higher risk. And that's a good way to kind of risk stratify all these activities. Outdoors, going surfing is probably a pretty low risk right now because we know that the UV light actually kills this virus. So outdoors where you're surfing, you're not getting very close to each other. So those sort of activities. Just outdoors on a boat, though, that's very different. I've seen a lot of boat gatherings of young people together, and you're still sharing each other's same air, and you're on a boat for hours on end. So you're going to be really, really putting people at risk by doing those sort of activities.
All right. So meeting close contact with other people is something that we should probably avoid doing. Meeting in indoors where there's poor air circulation. Also, where areas that are very crowded are probably places that we shouldn't be. Are there any other things that we should avoid? Or I guess in simple layman's terms, what should we keep in our head when we step out of our house?
I think you nailed it on the head right there. Okay. It's just like anything that's indoors or anywhere where you can't physically distance without a mask on, and anytime you're sharing contact with people. All right. Or beverages or drinks. Yeah.
Great. Yeah. We did prelude that we have a special guest at the very beginning of our show. I was wondering if we can bring in our special guest that will be tuning in.
We're going to bring in Pat here, and we thank him for coming on to talk about his experience. He was recently, had some symptoms consistent with coronavirus and ended up getting tested and testing positive. Patrick, thank you so much for having us on.
I can hear you guys. How's it?
Okay, great.
Aloha, Patrick. Hey, thanks for joining us. I think our audience is really excited to hear from someone that is in the situation that you're in. Could you give us a quick introduction to yourself? We know that you're a local boy born and raised here. What happened in the past couple weeks, and perhaps what was your thought process, and where are you? What situation are you in now?
I grew up here, as you said, born and raised here, and I thought I was doing a pretty good job of wearing a mask and keeping my guard up. And I think when things opened back up, some of us, including myself, kind of let our guard down. We were doing little gatherings here and there, and unfortunately, I contracted the virus at some point. Still trying to figure out exactly how. It's been difficult to figure that out, to say the least. And I think I might have figured out when it happened or when I had transmitted the virus to someone else, because I got symptoms last week, Monday. So that was the 3rd. And it started with I woke up in the morning and I had chills, just like the worst chills I'd ever experienced. And so that was kind of the first red flag. And from there, I was able to fall back asleep, but then I woke up again that morning and I had a cough. So it was like, woke up middle of the night, chills, woke up at 8 a.m. the next morning, cough, just started realizing I had more and more symptoms. So I did one of the self-assessment tests and realized, I'm kind of checking off a lot of the boxes. However, I was taking my temperature and I had no fever. So I was kind of like, shouldn't I have a fever? And I didn't. So, I called my PCP and they directed me to the COVID hotline. And then from there, they told me, you don't have a fever, so we're not necessarily going to have to test you right now. And so that was kind of alarming because I have nearly a 2-year-old daughter, and she was kind of she was my first priority and my first worry. So we really wanted me to get tested just to clear the air, have peace of mind kind of thing. And so then I called the hotline back and I said I had a fever, and they said they could test me that afternoon. So yeah, it's kind of been a whirlwind of the last 10 days, and I've been in quarantine, self-isolating down here at my parents' house, and everyone's safe. My parents are negative. So it's been a blessing. I'm pretty sure that I've only infected one person, or that person infected me. It's hard to tell. But yeah, it's been quite a journey so far. Contact tracing everyone that I ran into in the last 2 weeks kind of thing was really stressful, to say the least. You get a varying of reactions. A lot of people are understanding. A lot of people have a scary reaction where they freak out and they think that you've done this on purpose, or that you knowingly went around them when you had the virus, which we all know is not true. I would never endanger any of my friends or my family knowingly. And so that was, people are going to react the way they react. Some are scared, and it's a scary virus. And luckily myself, I had a fever for less than 8 hours, and it came and went. And by Tuesday morning, I was all good. I felt fine, and yeah, it came and it went. And for me, I felt top shape by Wednesday. Tuesday, I was super tired, and then of course I found out on Tuesday. I got my results pretty quickly, which helped with my friends in contact tracing, and they were all able to, get tested, or get the people that were at risk tested. So I had a couple friends that I had seen, and one was very at risk, and he was on the forefront of my mind. So finding out so quickly was very helpful, and luckily him and the other people that were at risk were negative. So it was a bit stressful. Didn't really sleep much on Tuesday night after finding out my results, and yeah, it was pretty nerve-wracking, pretty stressful. So it's kind of where I'm at. Luckily, I'm a healthy guy, so I've recovered pretty well.
Yeah, thank you, Pat. We're really, really thankful that you're doing well, and that you've recovered. And thank you for sharing your story. It takes a lot of courage to talk about this, and tell the message exactly that we're trying to relay, that you can get infected before you know it, and also infect other people. Do you know roughly a couple days when you possibly were infected or with that other person before you started to develop symptoms?
Yeah, so doing my own research and talking with my doctors and whatnot, I found out that the 2 to 3 days previous to your symptoms is when you're most infectious. Correct me if I'm wrong, Dr. Darragh, but that's what I've come to realize.
You are right.
And yeah, me and the one friend who's also tested positive that I hung out with the week prior, me and him had dinner. We had a little, our kids got together. We had a little play date, a little dinner date kind of thing. And, he cooked, or his wife cooked a lovely meal. And, we might have traded glasses of wine. It was just something as simple as that. We mixed up our glasses of wine, and unfortunately, we think that's kind of what did it, because, he ended up testing positive. He got symptoms an entire, probably about 36 hours after I did. And yeah, so unfortunately he tested positive. He kind of had all the same symptoms I did. And luckily his wife was a negative, and his kids were able to go live with their grandparents up on the North Shore. So they were able to self-isolate. And, I think getting ahead of it is what you really need to do. And he had to inform his work just like I did. He had to call his friends that he had seen over the weekend, because we had a dinner on Friday night, and Saturday, Sunday, those are, it's the weekend. It's busy. You're seeing people, when you feel like you're comfortable with those people and you feel like you can trust those people, your friends, that's when your mask is off. And, unfortunately, you just don't know. Someone can be asymptomatic. Someone can be, not even have symptoms yet. And you just never know. And so, as you said, bring your own everything, I think is a very wise decision, because, we thought we were doing a pretty good job of not sharing anything, but yeah, it was as simple as mixing up a wine glass kind of thing. So you just never know. And the unfortunate thing is he may have gotten other people infected, and the 2 people I've talked to, they're also friends of mine. They are asymptomatic. So they had no idea they were infected, and until they got tested. So it's a scary silent virus, and you just don't know who's infected, who's not. And, unfortunately, it's our demographic, our age range that is the ones that are spreading it the fastest. And as the newspaper said the other day, we're now super spreaders. So it's crazy. Yeah.
Yeah, you're exactly right, Pat, when you said that, the incubation time is on average 5 to 6 days. And so those 2 to 3 days before you started to have symptoms are actually when you're most infectious to other people. And so that's why it's really important to what you're harping on is act like you have it, and then you won't spread it. Act like you already have it. So that's important.
Yeah.
Yeah, and you mentioned that it's a silent virus. Wanted to thank you for providing a face, because not only is it silent in terms of how it behaves as a virus, but I don't think enough of these stories are being told, and these faces are not being seen. So we really appreciate you coming on live with us to do this. And there are also people in the comment section that are thanking you for sharing your story. We also received a question, a couple questions actually. They're kind of interested in what your interaction with the Department of Health was, specifically the contact tracing interview process. Would you be able to kind of walk us through how that went? Did you get a call, and was it a series of calls, one call, and kind of what was the interaction in that?
Yeah, so the first call you get is I did my test at Queens Urgent Care in Kapahulu. So Queens called me first, and then from there, I believe they relay the information about the positive test to the Department of Health. So then I got a call from the Department of Health. They just asked a quick series of questions. They're trying to do their best contact tracing, and from watching the news the other night, I think we all understand that they're a little strapped for resources and for staff, because that was the only call I've ever gotten from the Department of Health. And I feel like I've done the majority of the contact tracing on my own, calling my friends and family and work and whatnot, letting people know, getting the information out. It was one phone call. The interview process was just asking, who I had seen, where I could have possibly got this virus from, and it's just so hard to say with like the incubation period being so long, where I ended up getting it from. And based on the positive results, there's only one friend who also got it that I had hung out with. So luckily everyone else was able to get tested, and that's what I told him. I said, hey, I went out to dinner here one night at a friend's house. I went to play golf here. I did certain things, and they've just I just got that one phone call. So it's kind of disconcerting, I guess. But at the same time, I understand that there's a whole bunch of infections right now, and they are strapped for resources and staff. So yeah, it's I believe we need a little bit more help. But as Dr. Darragh was saying earlier, they, a month ago, we didn't have this many infections, and we didn't need that many contact tracers, and now there's an immediate need, it's scary, but it's what it is.
Pat, I got a quick question for you. I know that the Department of Health is developing a contact tracing application where it's almost like a digital diary where it's just logging your information on your phone. It's not tracing you, tracking you. It's not sending anything anywhere. Basically, it would be like a digital diary of where you were in the last week to 2 weeks before you had your symptoms. Would you have found that it would have been useful for you to go through that? To be like, hey, I was here.
Yeah, because that's, basically what I did was I took out my planner and I tried to just, even people I saw randomly at the supermarket or whatnot, I tried to go back or people I saw at the beach, just randomly, like friends that I ran into. I tried to go back and trace back every one of those friends, write all the names down of the people I had seen, all the activities I had done, whether it was with my daughter or work related or, meeting up with friends, for dinner kind of thing. And just, if I had a diary like that, that would have made it even easier, and it would have helped the Department of Health out, just kind of tracking, what restaurants that I went to, what, maybe golf courses I went to, just that kind of thing. And I think an app like that would have been very helpful, and it would have been much more informative for the Department of Health, because there's only so much you can remember and say on a 20-minute phone conversation. And, I tried to relay as much information as possible, but I mean, that's just not enough time to, do it all. And if you had an app where you relayed all the information you could, that would be, I think, even better.
Yeah, the good news is it's in development, and so hopefully that's going to be released shortly. And I do think it would be a great tool. So thank you for illustrating that eloquently. Yeah. So the Department of Health should be releasing it hopefully shortly.
That's exciting news, and it also makes me wonder if we can, until then, do it kind of analog, and if people would mind writing things down.
Yeah, you did a great job, Pat. I mean, remembering you had your planner, and so thank you for being really diligent about it. That's not everybody can do that.
I was just more worried about all my at-risk friends and their families. Anyone they could have spread it to, and I have a bunch of friends whose wives or girlfriends are Hawaii right now, and that was definitely weighing on me pretty heavily too. So. Just had to get the word out. It's nothing to hide from, and it's better to be ahead of this than behind it. So that's what I did.
You sharing your story in this capacity is invaluable, and we did want to give you the opportunity to kind of share what is your message for people our age who are fortunate to perhaps not have contracted COVID yet. What would you want to tell them at this time?
I would want to tell them to be vigilant. Keep your guard up. This is no time to let your guard down. I know us younger folk, we got a little comfortable, but we all have kapuna. We all have moms and dads. We all have friends and family that are at risk, whether they have asthma, diabetes, whatever it may be. And we need to be vigilant for their sakes, because their immune systems may be compromised, and we're healthy. We're healthy young people, and it's no time to let our guard down. We got to keep wearing our masks. I have my mask handy for whenever I get. Luckily, I have two loving parents that are delivering me food every day and cooking for me, because I'm downstairs and I got no kitchen. So we got to stay vigilant for our kapuna and for our parents and the older generation and the at-risk generation. So it's it's time to stay vigilant, and keep your guard up. It's a scary virus, and being on timeout down here for 10 days is nothing. Honestly, I got one more day to go, and then I'll be able to see my daughter again, and that's what I look forward to the most. So, just stay vigilant, guys.
Stay vigilant and keep your guard up. Powerful message coming from you. Thank you so much.
Thank you, Pat. Absolutely.
Thank you, Pat.
You're welcome, guys. Thanks for having me. Appreciate you guys. Aloha.
Aloha. All right. Well, we covered so much, and ending with Pat on that note really drove the point home that we need to keep our guard up and to be vigilant, and especially as young adults who are making up the biggest proportion, that we have a certain responsibility to be mindful of.
Absolutely, guys. Pat said it perfectly, is that this can happen to you before you know it, and then you go ahead and think about all the at-risk family members or friends that you've come in contact with. So it's important to act with caution, act with care, wear your masks, physically distance, bring your own everything, I think is a good idea, and stay safe out there. And let's not be first in the nation. In 2 weeks, let's be a lot improved. Okay. So aloha to everybody out there.
Hello, everyone. On behalf of us and Every1ne Hawaii, we hope that you all stay safe, stay healthy, and please take care.